This is the 7-site Skinfold assessment. First of all measurements must be done on the right side of the body. The participant should be dry and lotion-free, and be sure to use the right hand for the caliper measurements, as the left hand will be used for grasping the skinfold with the thumb and forefinger. Grasp 1 centimeter above or below the area the calipers will be measuring, and be sure the caliper dial is facing upward and is perpendicular to the skinfold. Record the skinfold measurements to the nearest millimeter and allow 1 to 2 seconds at every site before releasing the jaws of the caliper. The measurement should be taken in a minimum of 2 times in rotational order to allow the skin to return to normal texture and thickness. If the measurements are not within 1 to 2 millimeters, retest a 3rd time. These calculations will be used for body density and body fat percentages. It is best to use a marker to mark the sites before caliper testing. The first is the triceps, making sure to be on the right side of the body, is the posterior midline of the upper arm halfway between the acromion and the acromion process. And make a mark. The next is going to be the subscapular, which is 1 to 2 centimeters below the inferior angle of the scapula, which is easier if the person's arm is behind their back. Make sure they release this before taking a test. The next is the mid-axillary line, which is at the level of the xiphoid process of the sternum, or approximately halfway between their armpit and the top of their hip. The next is the chest pectoral, which is on 1/2 the distance between the anterior axillary line and the nipple for men, and 1/3 the distance between the anterior axillary line and the nipple for women. The next is the umbilical. This is a vertical fold that is 2 centimeters right on the right side of the umbilicus. Then there is the superiliac, is the line with the natural angle of the iliac crest taken in the anterior axillary line immediately superior to the iliac crest. The last is the thigh, which is the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease. Once all sides have been marked, go back with the calipers to tag the actual measurements. Be sure to grasp 1 to 2 centimeters above the mark of the vertical fold and hold to 1 to 2 seconds. For the subscapular, be sure that their arm is in a relaxed state and take a diagonal fold 45 degrees and make sure that the calipers are perpendicular. The mid-axillary line, they can place their arm either behind them or on top of their head as long as they're in a relaxed state. Once again, 1 to 2 centimeters above or below the vertical fold and hold for 1 to 2 seconds. The chest pectoral is a diagonal 45-degree angle test, and for women it might be prudent to make sure that they move their sports bra out of the way while the measurement is being taken. The abdominal is also a vertical fold. Be sure that your fingers are not in the way and that you are above 1 to 2 centimeters above the site of where the measurement needs to be taken. The superiliac is a diagonal fold that needs to be taken at a 45-degree angle of the natural angle of the iliac crest. The thigh is a vertical fold, the last one, and it is to be held for 1 to 2 seconds, and that they are not bearing weight on the leg that is being measured. Once all skinfold measurements have been taken, take the sum of the 7 skinfolds and plug them into either the male equation or the female equation for body density. These will be needed for further calculations of the body fat percentage shown next. Once you have that, you can either use the Brozak equation or the Siri equation and the body density number that you got before on the previous equations to find out body fat percentages.